A question I get a lot is whether you should use ice or heat when you have a pain or something sore in between visits. That's not an easy question to answer unless I actually put my hands on you because they're used for two very different things. Ice is used when you have inflammation in an area, and heat is when you have a muscle spasm or a tight muscle. And then sometimes you can have both at the same time. So, a good rule of thumb is if you need ice, the area might be warm to the touch, or might feel puffy or soft, and that's a good time to use ice. And it's a hard, fast 20 minutes. Set a timer for 20 minutes, no less and no more on ice. Heat is when you're real stiff and you have a muscle spasm or it's very, very, very tight. Heat will always feel good while it's on, and you can kind of fudge the time on the heat 15, 20, 30 minutes. It doesn't really matter. However, if there's inflammation in the area and you put heat on it, you're going to increase the inflammation, which can increase the soreness. While the heat is there, it will feel good while it's doing that to you. So, the good rule of thumb I tell my patients is that when you take the heat off, if the pain comes right back, or if it hurts worse after you take the heat off, throw ice directly on it for 20 minutes to take care of that inflammation that the heat um, brought up. Now, if you have both, you need both ice and heat. The hallmark is a cycle of ice, heat, ice, 20, 20, 20, right back together. 20 minutes ice, 20 minutes heat, followed by 20 minutes ice. Then you give your body at least a 20-minute break in between those cycles, and you can do them as needed. Sometimes people don't have that time to do all three cycles. So you can do heat first, but always end with ice afterwards, and then give yourself the 20 minutes in between.